Hello, everyone. Today we will be highlighting the Age of Enlightenment, which was the period 1700 through 1799. This presentation was created by Habibah Jabbar and Lorena Hurtado. So a little background about the Age of Enlightenment. The Age of Enlightenment was a philosophical and intellectual time period. It was a time of revolution, laws, ideas of God, industrialization, inventions, and scientific discoveries. During this time period, the French and American revolutions took place. Tremendous population growth resulted in overcrowding and increased sanitation problems. The working class often experienced unsafe and unhealthy working conditions. Plagues and other epidemics continued to be problematic, such as smallpox, cholera, diphtheria, yellow fever, and malaria. And Enlightenment thinkers were influential voices during this time period. Central to the Enlightenment period was the use of reason, which was inspired by the idea of understanding the universe, improving the human condition, betterment of health, and the possibility of creating a better world. There were many scientific milestones that were significant to the health education and promotion field. In 1701, Massachusetts passed isolation and quarantine laws. This was seen in the isolation of smallpox patients and for ship quarantine. These prevention measures helped to reduce the spread of disease. Health boards and committees were formed in several cities during this time period that were meant to address health-related matters and health problems. In 1789, the first life expectancy tables were created in the U.S. by Dr. Edward Wigglesworth. This indicator is important for assessing population health. It also helps to explore the living conditions of populations, allowing us to compare it by generations, analyze trends, develop plans, and interventions to help improve quality of life. In 1798, Congress passed the Act for the Relief of Sick and Disabled Seamen and authorized the formation of the U.S. Marine Hospital Service. Seamen were viewed as essential to the developing country. However, oftentimes they became ill while at sea and were unable to find adequate health care in port cities. The establishment of a network of marine hospitals to care for sick and disabled seamen is significant to the health and education and promotion field. This shows how health, education, and promotion not only work at the individual level, but at multiple levels. Identifying health issues within specific populations led to the influencing of resources, policies, and programs to improve health outcomes.
Enlightenment thinkers that impacted the health education and promotion field. In 1796, the first successful vaccine was developed, called the smallpox vaccine. An English physician named Edward Jenner discovered that individuals who contracted cowpox did not contract smallpox, and that exposure to cowpox provided protection against smallpox. To prove this theory, Jenner experimented by injecting a 9-year-old boy with cowpox lesions. Jenner then repeatedly exposed the 9-year-old to smallpox. However, the child did not develop the disease. Intensified efforts were made to educate and vaccinate populations that were affected, which over time led to the eradication of the disease. Today, vaccinations continue to play an important role in promoting good health and preventing diseases. We have continued to see mass vaccination campaigns for polio, swine flu, H1N1, and more recently, COVID-19. John Hunter, known as the father of scientific surgery, was a teacher and a well-known surgeon. Through his years of experience in dissecting over 2,000 bodies, Hunter learned the importance of gathering observations and preserving evidence. When teaching his students, he would always advise them to conduct experiments, to review and change their work, and update their methods so that they could learn from their errors and gain a better understanding of their work. The attitudes and beliefs he pioneered are still being practiced to this day, For example, when creating health education and health promotion programs, gathering observations can be used to collect data and or information to assess or understand different populations and health problems. Additionally, preserving evidence is commonly used when evaluating health education promotion programs to have an idea of what improvements have or have not been made and used for future program planning. So this is a summary of everything that we talked about throughout this presentation. The Enlightenment period was a revolution of thought that greatly impacts health education and promotion today. Enlightenment thinkers promoted health literacy, communication, and education for better health outcomes. The development of healthcare networks, committees, and boards optimized care for populations. Laws and policies were created to prevent and improve public health. Scientific advances during the century planted the roots of health education and promotion.